So good morning to you, Karol, in Western Australia.
Good morning. Well, it's good afternoon here.
Okay. So I'm Michelle
Yes.
Clarke, Director of Nursing and Quality, working for Worcestershire Health and Care NHS Trust. And would you like to introduce yourself?
Yes, I'm Karol Edge. I work for Peel Health Campus, which is it's part of Ramsay Healthcare, which is a private provider, but we provide a public contract here in Mandurah, which is in the southwest of Perth.
Okay, lovely. So I just wanted to prick your brains really on flu, as I know it's been particularly bad for you over there, and I've been reading and hearing that Western Australia has had its worst ever flu season, with over 22,000 cases confirmed of flu compared to just over 3,000 last year. Reading the information, that's like a 590% increase. I just find that incredible.
Yeah.
And I know it hit you 2 months earlier than normal for your flu season.
Yeah.
We're now coming into flu season, and we're trying to sort out our vaccination programme and everything. So I just want to know, how does it feel for you over there now coming out of the flu season, and how did it feel being in the thick of it with the flu season?
Yeah, it was difficult. Last year, and I suppose you need to look at the data. Last year was a particularly light flu season compared to this year. So when you look at the data and the increases, the figures might be skewed a little bit. However, there was a massive increase. One of the things that they wanted to do, and one of the actions WA Health had taken around the flu vaccination, was actually to delay when we gave the vaccinations this year, and they wanted all of the hospitals to give them at the same time. The problem was flu hit before the date was for the vaccines, so caused a little bit of angst. We did get an agreement to give our vaccines a week early, but sort of from a hospital perspective, and we're a fairly, compared to the UK size hospitals, we would probably be seen as a fairly small district general hospital. And we sort of filter into more acute hospitals in the area. So it really affected our capacity both within our ED, had a massive impact on it. We have a similar 4-hour target here. And just at one point we had to actually close part of our emergency department to make it a flu area, because we had so many patients waiting to get into inpatient beds. But obviously before, waiting for swab results and different things, and trying to get single rooms was causing a massive impact on the department.
So is it mandatory that all your staff are vaccinated over there?
Not in WA. One of the beauties of Australia, it's very strange. It's one country, but we have different states, and each of the different states has a different rule. So in Victoria, it's mandatory. It isn't in WA at the moment. So our uptake this year on flu vaccines was 54%, which is not a huge number. On top of that, we've also vaccinated the majority. We have external pathology on site. We vaccinated the majority of those. We have external radiology. We've vaccinated them, and also our nursing students. But last year, we only vaccinated 43%. So we did have a big increase. As you know, it's 11% on top of what we'd done last year. But one of the other problems was we ordered the same amount of vaccines as we ordered last year, because we've tended to have a trend and have the same amount of staff who uptake. We ran out very quickly once flu hit. You'd find the girls who were doing the vaccinations were, people were waiting outside of their door for them to arrive, because they suddenly wanted vaccinations. But by this point, the people who were proactive, the 43% that not always have it, had theirs. We were getting to the point where we hadn't got many left, and people suddenly wanted them. So I think we probably could have hit at least 60% had we not had a shortage of vaccines when we needed them.
We've done quite well over the past couple of years with our vaccination. We've got just over between 70 to 75% uptake. But it's always difficult trying to get the rest of the staff to understand the importance of having the flu vaccination. And I suppose I'm looking to you to say, is there any lessons learnt from yourselves this year that you might think you'd do differently for next year? And I suppose because there was such an exponential increase in people having the flu, was that making the staff by the sounds of things, more keen to have their vaccination.
Absolutely, and I think we had, certainly within ED, one of our ED consultants got flu, had influenza A and was very, very sick,
Right.
as were a couple of the nursing team. So, you know, peer pressure is a fantastic way to get people to have vaccines. And there are people that just didn't want to end up in that position. So that's what we did, was just made sure, you know, got that message across. They were sort of quite key players, so that helped really move that through. But I suppose the biggest message for me, and it comes from my days of work within the UK, I did emergency planning and it had that in my portfolio around the pandemic flu time.
Yeah.
And it's about, and you know, as much as we want to protect our staff and protect our patients, this is about your family. Do you really want your family to be sick? And when you're working in a hospital environment where there will be flu in there, the best way to protect them is to be vaccinated so that you're not taking that home with you.
Yeah. Okay, thank you. So
I suppose the plans for next year is sort of to look at the data, which we generally tend to do. I think it came a bit at a left field, but just to try and be a little bit more prepared. Try and sort of tap into with staff who did have flu last year and have those conversations, but also just making people understand that it's not a one-off vaccine. You need to have this done every year because, you know, strains do change, and sort of make sure we've got some more vaccines this year. We have our pharmacy on site are fantastic, and they help us no end. So just working closely with them, because they did manage to get us some extra vaccines in. The thing with the health service in Australia is a lot of things like pharmacy, radiology and pathology are third-party providers. So it's working with them and having good relationships. But I think it's certainly, we will be planning sooner and just trying to get abreast of what you know, the Department of Health thinks is going to happen, and just trying to be a little bit ahead of the game, really.
And were you wiped out quite a bit with staff if they hadn't had the flu vaccination? Did it affect, although you said some were really poorly, had you got a lot off?
Yeah. Yeah, we did. I mean, it wiped out our staffing, and we had challenges from a patient point of view, but also challenges from a staffing point of view, because just trying to cover it. The issue was because it was the whole of WA was affected. Anyway, you know, if you're trying to use agency for resources, obviously everybody wanted the agencies, but even the agencies were struggling as well, because they've got staff who were going from hospital to hospital, and, you know, unfortunately would be picking things up.
Right.
I mean, ideally what I'd like to do is for WA to become a state that makes it mandatory, a mandatory vaccination programme. And it will be interesting if we do go that way. Certainly it's worked in other states. And don't get me wrong, I used to be that nurse that would never have a vaccine until I did the pandemic flu information, you know, and I had a young baby at home at the time and he was in the vulnerable group, and I just thought, oh no, I'm not prepared to take that chance, and I have it every year now, and would never ever, you know, not do that, because that's about protecting my family as much as it is about having a safe workplace.
Yeah, and I absolutely echo that. I have my flu vaccination to protect my family, my elderly parents, and it's really important, isn't it, that we lead by example and encourage the rest of our staff to follow suit, really.
Yeah. And something that's come out this week, I was just looking at some influenza things because I knew you were going to be calling me today. And even, you know, the high numbers that we've had, the 22,331 confirmed cases, those are just the people that were actually swabbed. And we know that there were very many more people who wouldn't. So I think that's, you know, there's probably almost double it for the people who didn't go and get swabbed. One of the other things I think to think about from a hospital perspective as well is when we first started doing this, the swabs took sort of 2 days, 48 hours to get your results back. And then as we moved on, we discovered that there was some fast track swabs that you could get an initial result within, you know, a sort of 30 minutes. So just to be thinking about it from that point of view, find out what's available for you, because obviously 30 minutes makes a massive difference. Because of the way the different influenzas work, similar with your infection control department, some we could cohort, some we couldn't. So I think influenza A we could cohort, influenza B we couldn't. But what we found was by doing that quick 30-minute swab, Some of them were, if it was going to be a non-cohortable one, sometimes you had to do further swabs, but you knew that if you could cohort, and it just helped you move people through the system a lot quicker.
Great. Okay, thank you. Is there anything I can share with you, Carol? You've given me loads of information.
It's really nice to have you now as somebody that I can tap into as we're looking at different things, and it'll just be interesting to see how it does go, and if it follows the same pattern as it has done. It generally does. I know, from my days in the UK, we always used to be watching what was happening in Australia, and generally it followed on. So it'll be interesting to see. But I suppose the thing I'd like to find out is how you've gone from a 30% uptake to a 75% uptake, because that would be fabulous, absolutely fabulous.
Yeah, no, and I'm happy to share that with you, because we've had a targeted workforce group working on the flu. We've had flu champions, so that we've got team members identified for each team that will vaccinate the rest of the team, and that's had a real positive impact. And we've got some real excellent flu champions out there who will go to all of the meetings, go to all of our special events, and vaccinate as many people as they can do. We've now got coming up this year, so we've got our staff awards in a couple of weeks' time, and there's going to be an award for the person who's vaccinated the most staff, and one for the team.
Oh, fantastic!
The most staff. Kind of recognising and appreciating that they've gone over and above and beyond, and everyone's done really well, but we've got some people that have vaccinated at higher end of 80 plus staff, just by one person. So that's good, and we identify some of our areas which maybe don't have the vaccination not so easily, so we try and do some work with them to find out why, because there's a lot of myth busting, isn't there, in terms of why do people want vaccination or not. So I'm going to say, I know, thank you very much for that. It's been great. I'm going to carry on talking.
You're absolutely well.
And that's fine. You don't have to go, Jane. It was just so that we don't have to look so prim and proper now. We won't use these bits, but just
do you want me to stop recording?
Oh yeah, I can. Yeah, stop recording.
I'll just stop recording now.